Hey there, I'm Dr. Bill Tortoriello, your local DNS Pediatric practitioner. If you want to hear some great handling tips for you and your first trimester babies, I've got you covered, so stick around. Just to be clear, these tips pertain to babies aged between about 2 months old and 4.5 months old. While they should not be considered formal prescriptions for treatments, they can be considered great handling advice for those babies aged between that 2 and 4.5 month old period to guide normal, healthy development. To begin with our babies lying on their backs, we want to be able to show them what's possible from this position. Whether that's raising both of their hips and legs up and off the ground, or simply passively controlling their head in the midline. These can all help facilitate these normal developmental patterns. We can also take both hands and touch them together. Believe it or not, this is the first time your babies start to realize that they have two hands, as well as bringing objects from their hands to their mouth. These are all parts of normal development that we can help facilitate through movement. One helpful handling tip while our babies are lying on their backs is for our parents to use their own hands to physically lower the baby's ribcage down to the floor just a bit. Now this is a gentle procedure, but you will hold the ribcage down for minutes at a time. This can be done throughout the day as many times as you like and actually helps to facilitate normal stabilization throughout the low back. It removes any excessive arch to the low back and helps the baby to lift their legs up and against gravity. During tummy time, with our babies on their bellies, we actually want parents to get down onto the floor to meet their babies at eye level. We also suggest only placing toys within about 30 to 45 degrees of the midline because our babies cannot control their head and necks beyond that point during this time frame. Remember, by 3 months old, your baby should be able to support through its elbows to raise its head and neck. By 4.5 months old, it should be able to raise its head and neck even further, going so far to be able to reach with either one arm or the other to play with toys. Now for parents, if we want to help with these developmental milestones, we can position our babies in these positions, which will help to give them some experience. We can also help to facilitate reaching by simply placing toys to the baby's sides. If your baby prefers to reach with only one arm and not the other, I suggest placing a lot of toys on the other side to help them to get to reach with that non-preferred hand. Well, it's about that time. Thanks again for your consideration. I'm Dr. Bill Tortoriello. If you like what you heard, feel free to subscribe to the channel and hit that like button. If you have any particular questions, please comment down below. Otherwise, I'll see you next time.